Good morning, everybody. Myself, Dr. Neela Mandrade, as Dean of Nair Hospital Dental College, I welcome you one and all to this live webinar which is being hosted and conducted by our Department of Periodontology in Nair Hospital Dental College. And for this, I appreciate our Head of Department, Dr. Mala Dixit, and her entire team of faculty, right? Dr. Pranita Kamble, Dr. Sapna Rao, and Dr. Aparna, Dr. Sandeep Pimple, and others, all the PGs who have come together to host this very special program. And for this, we have two of the very renowned speakers who are going to be talking on some very special topics. For example, if I may quote Dr. Rajiv Chidgappi, who's going to talk to you about how important it is to have a digital platform today to bring forth in the social media how important dentistry is and how important your jobs are, which will be carried forward to the society and the public, giving them an awareness on the digital platform about dentistry and all the technologies and the advancements that are available in the management of oral hygiene. And I think it is a very chosen topic, because this is the need of the hour, and this is how we outreach maximum to the society through a social and a digital platform. So I welcome Dr. Rajiv Chidgappi, and I thank him profusely for accepting our invitation to give you a talk on this. Besides him, we have the other speaker, Dr. Ashutosh Karnik, and the topic that he will be speaking to you about is making or convincing patients to go in for dental implants. Today, dental implants is the need of the hour. Restoration of lost teeth with dental implants is a big thing, and probably the best thing that can happen to human beings and to your patients. But they need a little convincing on this. They need to be educated and motivated for this. So in that too, I feel it's a very good topic which he's going to be speaking to you about, on how to carry this information and motivate and convince patients to take up to dental implants as a treatment procedure. So on this note, I thank all the participants for coming forward for this live webinar, and I congratulate the Department of Periodontology, the HOD and her team for organizing this event, and I'm sure you will get to gain a lot from the most interesting talks that will be put up and the interactive discussion that would take place. Thank you, and a big welcome to all of you for this live webinar. Thank you.
Hello everyone, and a very good morning to all the participants who have tuned in this morning. I am Dr. Rutali Kamath, Assistant Professor, Department of Periodontics, Nair Hospital Dental College. And on behalf of the entire department, I extend a warm, hearty welcome to each of you who has taken out the time to join us today on this fine Friday morning. This event is presented to you by NHDC, powered by ICPA. We just heard the lovely words of encouragement shared with us by our very own beloved and dynamic Dean Madam, Dr. Neela Mandrade. Robert Reed once rightly said, "A community that learns together excels together." And due to the unique nature of our practice, it becomes pivotal for the dental community to create a network that shares skills and expertise amongst the clinicians and also has a channel of open communication and exchange of ideas. As dentistry booms at an unparalleled rate, staying abreast with evolving concepts is a challenge in itself, let alone applying it to clinical practice. So, to make things a tad bit easy, we bring before you our dynamic speakers today who will shed light on two such topics not discussed before. These are facets which we never really taught in our formal training, but would make a world of difference if we had these tools at our disposal. Bearing this thought in mind, we commence today's program. We now have a lamp lighting ceremony with the Ganesh Vandana in the voice of Miss Rusheta Baburaj.
They are hearing something different.
Due to some technical glitch, we move forward. I hand over the stage to our moderator for this session. With a zeal to always keep learning and improving and a keen eye for detail, please welcome very own beloved Head of Department, Dr. Mala Dikshit Baburaj. Over to you, madam.
Hello, a very good morning to you all. Thank you, Rutali. A very warm welcome to one and all. Thank you for lending a ear and willing to join us as we talk on two relevant topics: patient acceptance and branding and marketing. For the past year and a half, our entire globe has been mired in not one deep crisis, but two: a pandemic and an economic meltdown. Dealing with all of this has taken a toll on our energy, attention, and for many of us, even our emotions. Speaking of economic meltdown, this pandemic has been a little more harsh to the dental fraternity. While telemedicine could to some extent cater to most medical needs and tackle a few issues faced by our medical friends, it was barely of any help to us. Most of us have experienced a negative decline in the OPD, patient attitude, and revenue. Most of us had to shut down their practice and do allied jobs to sustain life. With dental health being the most required yet highly ignored field, convincing patients and optimizing treatment options to provide the best possible care still remains a dream of many. Knowledge has to be improved, challenged, and increased constantly, or it vanishes. This is a good time to take a deep breath and assess the changes that have occurred. We, as a fraternity, need to go past this phase and learn newer techniques and modalities, just not to foster our skills, but also to promote patient knowledge and acceptability. While all this seems to be far fetched and difficult, we at NHDC promise in assisting you in this venture by providing valuable inputs by our two eminent speakers. Hopefully, with the pandemic becoming an endemic soon, we shall be applying all these tips given by these stalwarts in building our practice along with giving the best possible treatment care. Change is the only constant. Embracing the changing platform has its own pros and cons. Department of Periodontics NHDC goes virtual for the first time. We can see this in the teaser in the participants by the array of questions that is shot to our speakers which they have tried to accommodate in their presentation. Further, you could drop a question here or there in the chat box. We shall try to do justice for the same in the Q&A section. So without much ado, let me introduce you to you our first speaker, Dr. Ashutosh Karnik. Dr. Ashutosh Karnik has graduated from GDC Mumbai and completed his master's from NHDC with the Vice Chancellor certificate for the highest marks in MUHS. He has tasted both academics and clinical practice for the last 10 years and more. He has been having a keen interest in training, learning, and development, which he has successfully fulfilled by speaking in various platforms and exploring technology as much as possible. Today, he is speaking on improving acceptance for implant dentistry. In this presentation, it looks at the decision of getting implant supported teeth for from the patient's perspective and provides answers to the most common queries that dentists get asked related to implant dentistry. including the awkward issue of treatment fees. This presentation will prepare you for effective discussion of implant-based treatment plans leading to improved acceptance of treatments that you know that your patient needs. Without much ado, let's get started. Over to you, Dr. Ashutosh.
Thank you very much, ma'am. Let me just share my presentation. So, good morning to all of you, and thank you very much, Mala ma'am, for inviting me for this event. The bond between a PG student and a guide is a special one, and in my case, the bond with my PG guide is the special one for the right reasons. Uh, it is always a pleasure whenever I receive a call from you, ma'am, and every year I make a pilgrimage to your place to have the most wonderful dosas and filter coffee, which has not been possible in the last 2 years because of COVID. But I plan to get back onto that bandwagon soon enough. So it is awesome to receive an invitation from the place that made you who you are and the teacher that made you who you are. And I am very happy to have got this honor to present in front of you. So I welcome all the participants, and I hope that you will take back from this presentation at least a few points that you will be able to apply to your practice when it comes to improving acceptance for implant-based treatment plans in our patients. So let me begin my presentation with this picture. This is Shanti Karnik, and this is my grand aunt. And the moment when I got admission for BDS, I went to her and I told her that I am starting with a course to become a dentist. So the first line that she spoke to me after hearing that is, in 1972, I got my first set of dentures. I tried them for 3 days. I did not like them. I threw them in the garbage bin, and I have never ever gone back to wearing a denture again. So, if you really calculate, that's 46 glorious years of eating bones and nuts without dentures. You can't imagine the number of times I have resisted the temptation to try and take a look inside her oral cavity to see exactly how she's managing to eat all those things just with the help of her edentulous ridges. But then this should have been a warning signal for me that a patient who has absolutely not a single tooth in her mouth can actually pull on without dentures for such a long time without any compromise in their quality of life. Basically, at that time, we are we are into an educational course, which is an academic endeavor, and that academic endeavor continued as I started my master's program in Perio at Nair Hospital Dental College. And just a few months into my master's program, I happened to read a chapter which really was not nice for a new postgraduate student in Perio. And that chapter in Carenza is authored by this person, Dr. Philip Huol. Now, Dr. Philip Huol is a dentist and who also has a degree in epidemiology. And the chapter that he has authored is called Levels of Clinical Significance. So basically, the way the concept of levels of significance goes is every medical treatment as well as dental treatment, there are two aspects to the treatment that is offered to the patient. One is what is the likelihood of achieving the desired result, and the second is the desired result tangible or intangible? By that, what I mean is, can the patient's mind actually perceive the end result that you have obtained? For example, a tangible result in perio would be stopping of bleeding from gums because the patient can perceive it. An intangible result in perio would be the reduction in probing depth or gain in attachment level. So there is a nice table that he has made in this chapter, and that goes like this. So the size of treatment benefit, large or small, which is basically the likelihood of achieving what we are promising to the patient. If the likelihood is more, then the size of the treatment benefit is large. And then second aspect of it is the nature of treatment benefit, which is whether it is tangible, can the patient perceive it, or can the patient not perceive it. And on the basis of these two factors, he has essentially arranged all the dental treatments and medical treatments in four categories or levels: level 1, 2, 3, and 4. So, level 1 treatments are basically the magic bullets or miracle cures. So, for example, vitamin C2 cures scurvy. You give vitamin C, it offers a cure. There is no question about it. So, the treatment likelihood of achieving what the treatment sets out to achieve is very large. The end result is absolutely tangible to the patient. So, that's a level 1 treatment. Then level 2 treatments actually have tangible results, but the likelihood of achieving what they are promising to achieve is not very great. So treatments like these include, for example, applying a pancyclovir ointment to herpetic lesions. So they do result in resolution in some proportion of patients, but not very great number of people as compared to the placebo. The second type of nature of treatment benefit is intangible, and by that what is meant is the patient can't perceive what the treatment accomplishes directly. And for example, a level 3 treatment where the treatment likelihood is large or treatment benefit is large is something like antiretroviral therapy for AIDS. So the treatment results in reduction in viral load which the patient can't perceive, but the outcome is reduction in mortality. Level 4 treatments are intangible and the size of treatment benefit is small. There is one line in this chapter which says that most of the approved periodontal treatments fall under level 4 of clinical significance. So when I read that line, my heart actually skipped a beat and I started thinking, am I actually going to spend an entire career offering treatments which fall under level 4? And it's just human emotion, right? You have 4 levels and you are at the 4th level possible. So that thought was really not very pleasant for me at that point of time. uh, I carried on with the study, but then it was only later that I came across this line also by Dr. Philippiol. The finding that implant supported dentures improve quality of life has a higher level of clinical significance than the finding that scaling increases probing attachment levels. And if you really analyze this statement, it's actually very simple. A patient can't perceive improvement in probing attachment levels, but a patient can perceive the improvement in the quality of life that is offered by an implant supported prosthesis. So this did offer me some solace in the fact that there are some treatments which will be of greater clinical significance. But the truth of the matter that we have to understand as clinicians is, in dentistry, a large number of treatments that we offer actually fall under the category of intangible treatments. So the benefits are not tangible to the patient. And if a person has pain, it's a very tangible symptom. And relief from pain is also a proportionally tangible treatment benefit. But the truth is that a large number of treatments in dentistry are intangible, and which brings us to our biggest enemy. So intangibility of results means that the patient may very well choose to not go ahead with treatment, just as my grand aunt did not get a new set of dentures made. Because intangible results mean that the patient has a choice to decide what to want to spend their resources, whether it is money, whether it is time, or whether it is effort. So in dentistry, in reality, our biggest enemy is electiveness, and it stems from the intangibility of non-pain related dental treatment benefit. And this is not a new concept. It was recognized a very long time ago. In fact, this statement comes from the textbook of orthodontics, which is authored by Dr. Profit. And it says that since no one dies of untreated malocclusion, from that perspective, orthodontic treatment is always elective. And that's kind of how it is with almost all the non-pain related dental treatment. patients rarely will suffer fatal consequences for not having gone through the dentistry that the dentist is advising them. So now that the patient has uh, dentistry as an elective option when it comes to non-pain related dental procedures, they start comparing dental treatment with all the other elective purchases that they can make in their lives. And usually these purchases fall under the category of objects of desire. So in reality, our biggest competitors as dentists are not other dentists. Our biggest competitors are all these companies that sell these objects of desire. And just think about it. At this point of time, if you are thinking of buying something, I'm pretty sure that it falls under under these categories. You are either aspiring to buy a car, or you're aspiring to take a nice vacation at a good spot. You're aspiring to buy a gadget. That's what you're aspiring to buy. Are you really aspiring to get dental treatment done? So when we try to answer that question for ourselves, we realize that when we offer treatments that are not related to pain to our patients, the our patients are going to compare wanting to get that treatment with all these other elective purchases that they can instead make with their money and resources. uh, we are not trained to in any way communicate with the patients the value of what we have to offer, and we are not trained in that for a very valid reason. Dentistry is a vast science. We have to learn lots of treatment and diagnosis related information, and that leaves us with very little scope to actually study how can we communicate the value of what we are offering or asking our patients to get when it comes to dental treatment plan presentations. Contrary to that, all these other companies that are selling these other products, for example, a car, or for example, a smartphone, these are highly trained individuals whose only motivation is to communicate the value of their products and make you want to buy them or aspire to buy them. So as a result of all this, essentially what ended up happening was I came across a problem that I never anticipated. So in my life, at least in the early half of it, it was supposed to go very smoothly. I study hard, I get into a good college, then I study further, I learn the knowledge and the skills that are necessary to practice my craft. Then I start practicing and I start presenting the treatments that I know my patients need, and the patients say yes. However, what I did not anticipate at all is the fact that in the course of my practice, there will be soliciting involved. I will actually have to communicate the value of my treatment plans to my patients, and in order to make them choose dentistry over all those other elective purchases, and do this ethically without crossing the limits of ethics. So this became difficult primarily because I have always looked at dentistry as an academic endeavor and an academic choice, and I'm pretty sure that is the case with almost everyone. None of us wanted to enter into a business, so to speak. And the moment I came out of the sheltered, protected environment of Nair Hospital Dental College, where the risks that my patients, I was subjecting my patients to, were shared by so many other people. Uh, the moment I came out of it, and the moment I started practicing clinical dentistry, I started encountering resistance, and I started feeling that there is a lack of training in terms of how to solicit or how to ask my patients to choose dentistry over these other elective purchases. Then I tried to do my best to find remedies to alleviate this situation. And typically when you ask people, or when you ask other dentists as to how do you go about improving treatment acceptance, they will typically come up with these ineffective strategies: providing warranties, offering deals or discounts, and sometimes outright lying by omission, by omitting the inconvenient facets or facts that are associated with the treatment plan presentation. These are not effective because in the long run they don't work, and they definitely a lot of times do cross the boundary between presenting a treatment plan and presenting it unethically. So over a period of time, I spent some good long years reading and exploring various resources, and then I came up with an understanding that the only really effective strategy to communicate the value of your treatment plan is to build the good old rapport with your patient. And the only way that we can actually do this is if we are willing to spend time with our patients, lend them an ear, actually actively listen to them, and if we are willing to answer their questions. Now, that sounds really simple to do. In reality, it is not. And the reason why it is not simple is because we are conditioned to want to present treatment plans in either of these two ways. The first way in which we present treatment plan is what I call authoritarian model. And by what I mean by that is basically in this treatment plan, you are dictating what the patient should get. I know best, and that's that, and I will tell the patient what is necessary. In the scarcity model, which is the opposite end of the spectrum, we are actually too scared to tell a lot of dental treatment to our patients. So it typically goes like, if I talk about a lot of dentistry, my patient may not even accept one single suggestion and may go away to another dentist. So these are the two typical prevalent ways in which we present our treatment plans to our patients. But if you really think about it, neither of these treatment plan presentation models allows the patient to make the decision. In both of these scenarios, you are the person who's making the decision about what the patient should hear. In the authoritarian plan, you are thinking that you know better than the patient, and which is why patient should listen to what you are saying. In the scarcity model, instead of trying to tell the patient what are the different treatment possibilities, you are trying to make a decision that the patient may or may not say yes to X, Y, and Z type of treatment. And actually speaking, in any treatment plan presentation, the only entity that should make their decision is the patient. It's not us. So, what is the solution for this? The solution for this is a concept called co-diagnosis, and it was introduced in the 1970s by this dentist called Robert Barkley. And basically, what it involves is making sure that the patient understands the reason why the treatment that is being suggested is being suggested. That is one. And two, the patient is as much a part of the treatment plan presentation process as you are. What it does is it allows you to build rapport with the patient, and rapport is the thing that leads to trust. Think of it like this: you are trying to present a treatment plan for implants, which means that the patient will spend a significant amount of time, effort, money with you. And do you really expect them to say yes within the first 10-15 minutes of your interaction with them? It's really not fair, and it's really not possible as well. So the concept of co-diagnosis is what I follow in my practice. And the so essentially, to sum it up, the solution to our problem of not having as much of treatment acceptance for elective dentistry like implant dentistry is talking. And the right words create the right thoughts. So when you actually take the time to build rapport, gain trust, explain, speak, you can actually see that the patient understands the importance of whatever your recommendations are, and that increases the likelihood of the patient agreeing to the treatment options that you're presenting. Now, as I mentioned, our prevalent model of practice or presenting treatment plans is either authoritarian, which is what we would love to happen. I say that you get this, this, and this, and the patient just says yes, or it is scarcity based. So I will present only a few treatment options, and then I will go on increasing the treatment complexity as the patient goes on saying yes to me. And the reality is that neither of them work. We all will go through various stages in our dental practice, starting in the beginning with the survival stage, then in reaching the growth stage, and finally reaching a stage where we start making profits doing the procedures that we love to carry out. And as this progression happens, our authority increases. And what I mean by that is, patients are more likely to accept our recommendations just on the basis of our word. And that means that as you grow older and older or in your practice, your effort in having to present treatment plans will reduce, which means that you can potentially gravitate towards the authoritarian model as time goes by. But then in the late 1980s, internet happened. So we now have a breed of patients who suddenly have lots of information accessible to them at their fingertips. And as a result of that, even if you are senior in your practice, it is very likely that you are coming across an increasing number of patients who are asking you more and more questions. So, as dentists, we have to become comfortable with the fact that we are going to have to spend time and we are going to have to spend effort talking to our patients. It's not something which we are necessarily very happy to do, but it is something that we will need as we go ahead in our practices. So steps in co-diagnosis that are followed are in brief. I start with giving the patient a tour of their mouth, typically involving their photographs and X-rays. I then present the treatment possibilities. I answer questions that they have, and finally, I make the next appointment to ensure that the loop is closed, and I have the patient's follow-up coming up in the next few days. So this is a condensed version of my treatment plan presentation process, and the entire treatment plan presentation process is frankly a little out of the scope for this presentation. Today, we are going to focus on the third step that I have highlighted here, which is to answer questions and answer questions pertaining specifically to implant dentistry. So moving ahead, questions are an excellent tool for us to build rapport and to build trust between us and our patients. When it comes to implant dentistry, it is very likely that we will be subjected to a lot of questions simply because of the sheer toll that implants are likely to take on the patient in terms of the time, money, and effort that the patient will spend. So, uh, with this introduction, let me now move towards the section where I discuss the questions that you will be subjected to when you are presenting treatment plans based on implants. So, for the sake of convenience, I have divided the questions that patients will ask us about implants into four categories. And for just to give it a fancy name, I call them buckets. So the first bucket of questions are related to the what of implants. What is a dental implant? The second bucket of questions pertains to how will you place an implant in my mouth? So the second bucket of questions deals with the how of implantology. The third bucket of questions deals with the why of implantology. So why should I choose implants over other treatment modalities? That's the third bucket of questions. And the fourth bucket of questions is the should I of implantology, which is should I really choose implants? Do I really need them? So what we are going to do from this point onwards is take each bucket one at a time and discuss the questions that we are likely to get asked under each of these. So let's begin with the first one, which is bucket one, the what of dental implants. And the questions that typically fall under this umbrella are what is a dental implant and what does it look like? And the second question of this bucket is are implants safe? So let's tackle these questions one after the other. So the first question is what is an implant and what does an implant look like? And I can guarantee that you have heard this word n number of times when you have discussed implants with patients, and that word is screw. and the the immediate reaction that we have when we hear that word come out of the patient's mouth, it's not a screw, please. How can you call an implant a screw? But now I have put a picture of a model. It's a model that Nobel Biocare makes in front of you. Take a look at it. It actually does look like, it just looks like a screw. And that's an absolutely apt description for what an implant is. In fact, uh, people are really not aware of what a dental implant is, not only in developing nations like ours, but even in developed nations. So, for example, in a study that was carried out in Switzerland in a geriatric population, 33% patients described implants as screws. Now, why do we not like the term screw? And the answer is very simple. There is a hardware store right downstairs where I practice, and you can buy a screw for the grand total of 1 rupee. So the sentiment that it conveys is not necessarily very grandiose, and that's the reason why we do not like the description screw. But nonetheless, 33% patients in Switzerland, a developed country, described implants as screws. 16% described implants as nails, which are even cheaper, and 8% described implants as pins, which are even cheaper than nails. So, this is how people think of an implant. 14% people could not describe what an implant was at all, and 29% people in Switzerland had not even heard of what an implant is. So, whenever you are coming across a patient to whom you are presenting an implant supported treatment option, make an assumption that that patient has no idea what an implant looks like. uh, what I usually prefer to do is I prefer to have a physical model like the one that you see in the picture in with me, in order to explain the concept of what an implant will typically be like, because it makes it very visceral, very physical, and it makes the explanations very simple and straightforward. What I try to do is I try to avoid the term screw, and I try to substitute with a term like cylinders that work as root replacements. So that's a term that I usually commonly use when I describe what an implant is. But I would highly recommend you to get a very nice looking, high quality model, which actually demonstrates to the patient what an implant is and what does it look like. The second question is, are implants safe? And when the patients are asking you this question, basically what they're saying is, will it suit me? Will I have a foreign body reaction to the implant? So they're essentially asking you questions related to these two categories. Will I develop an allergy to a device that is placed in my body? And will it lead to cancer? So let us try and see how we can answer these questions. The first part is relatively easy to answer. Titanium allergy can be detected only in 0.6% of all dental implant patients. It is exceedingly rare to, but not, it's not impossible, but it is exceedingly rare to find a patient who is allergic to titanium. So the way I describe this to the patients is, I first ask them, have you ever made use of a cosmetic cream, like say a sunscreen lotion or cold creams or something like that? And typically patients will say, yes, I have. If you read the contents of a sunscreen lotion, you will find that it almost always contains what is called as titanium dioxide. Titanium dioxide is a white opaque powder, and that is used in large number of substances that we consume throughout our lives, including substances that we eat. For example, medications, capsules, tablets, sunscreen lotions, paints. It is used practically everywhere. In fact, if we just randomly draw our blood and try to test it for titanium, the presence of titanium, we will actually come up with an average of 50 ppm of titanium in our blood already, even if you don't have an implant in your mouth. So the fact is, we already are exposed to titanium and we tolerate it perfectly well. So the question on allergy is very easy to answer. No, you are not likely to develop an allergy unless you belong to the 0.6% population which is allergic to dental implants. The second one, can I develop cancer, is a little tricky to answer, because there is at least one report of a maxillary osteosarcoma. This report came out of Australia and it is published in the Australian Dental Journal. Uh, the maxillary osteosarcoma arose 11 months after placement of a titanium dental implant, and the treatment necessitated the removal of the implant as well as the osteosarcoma. So we can't say with certainty that cancer won't happen with implants. Having said that, again, the fact is titanium has a very low risk of carcinogenicity, especially when it is not alloyed with vanadium. So whenever you are choosing an implant system, typically implants are manufactured out of commercially pure grade 4 titanium, or grade 5 titanium. Compared to grade 4, grade 5 has a higher quantity of vanadium. Now, vanadium is the problem metal here. Having said that, even then, the Food and Drug Administrations across the globe have tried to test these for presence of or development of cancer, and have not come up with any convincing data that actually states that titanium implants pose a very significant risk for cancer. But compared to allergy, cancer is really serious, which is why this question has to be answered saying that the ones that we use have very low percentages of other metals, and they are almost completely pure titanium. And that is the reason why they are approved by all the Food and Drug Administrations that are there in various countries. So that's the typical way in which I would answer this question. So this is about the safety of implants. Zirconia implants are safer than titanium because they don't contain any of these. Zirconia implants are available with Straumann, but they come with their own problems related to their strength and typically the tensile strength, the typical problems that any ceramic has. So with that, we complete the bucket of the what of dental implants. Now, once you explain the what of dental implants, the patients will typically ask you about the how. How will you go about placing a dental implant in me? So the how of dental implants. And it typically involves these 4 questions. First question is, how painful are implants? Second is, how much effort will I have to spend when receive an implant supported restoration? The third is, how much time will implants take? And the fourth is, how much will implants cost? And let's tackle these questions one after the other. So the first point is, how painful are implants? And I think the thought that is going on in the patient's head is, are you seriously saying that you are going to drill in my bone? And do you really expect me to believe that I will be okay with that? There will be no pain associated with it? And so the way to answer this question is twofold. The first thing that you need to remember is the patient's point of reference. Usually, patients have experienced dental treatment in the past, and typically that involves excavation of decay followed by a restoration, or maybe a root canal treatment, scaling, and sometimes extractions. So the patient's point of reference is dental decay. So the way I go about explaining the first aspect of pain is, nerves in the bone are different from nerves in the teeth. And that's true. The teeth are supplied very richly with the A delta and C fibers, and they are extremely sensitive to all kinds of pain stimuli. So that is the reason why any kind of dental treatment is likely to hurt you a lot more. But now that the root is out, we are going to place an implant inside your gums and the bone. The nerves in the bone are simply different as compared to the nerves in the teeth, and that is the reason why you are not likely to experience as much pain as you experienced when you got your root canal done or when you were being treated for a filling. One more thing that I try to do, so that, and which brings me to the second aspect of this question, is we can always try and give them an idea of what can they compare the extent of pain with, because they are trying to estimate how painful is the post-operative period, the intra and the post-operative period going to be for them. Will I be able to speak? Will I be able to work the next day? Will I have to take a day off from work? All these are the questions that are going through their heads. So the word that I usually try to use here is, I try to tell them the distinction between pain and discomfort. And these two things are really different. So I tell them that if you pinch the skin of your hand, what you experience is pain. But then if you take a finger like your thumb and just press into your skin, what you feel is pressure. Now pressure is uncomfortable. You can make it uncomfortable, but it won't give you pain. And that's kind of the difference between pain and discomfort. Also try to tell them that some of the common discomforts that they have experienced in their lives. For example, if you hit your knee and if you are recovering from that injury, you will have you will have an uncomfortable awareness of that area of your body, but it won't stop you from your day-to-day activities. So this is the other way in which we can explain what is the extent of pain that our patients are likely to experience after implants. So this study comes out of Jordan, and what they did was they had a parallel study in which, sorry, a split mouth design wherein they extracted teeth, and then in the same patients they also placed implants, and then they recorded the pain levels after tooth extraction 6 hours later, 1 day later, 3 days later, and 7 days later. And what they discovered was the level of pain after extraction was significantly higher as compared to the level of pain when implants were placed in the same patients. So, until 3 days, implants actually give rise to very little pain compared to the uh, extraction sites, and 7 days later, the pain nearly reduces to zero. So, this is the explanation that I give when patients ask me how painful are implants going to be. Having said that, the next question that they are likely to come up with, just give me 1 second, is how much effort are implants. So how much time will I have to spend? What are the steps, and what is the process going to be like? And the key when you are explaining this part to the patient is to strike a balance between giving enough information and avoiding being gory. So if you show a picture of a beautiful surgery that you carried out, which had flap reflected and so on, the part that the patient doesn't want to see is blood. So never show them pictures of those procedures, because those procedures are good to share with your dentist friends, but they're not good to share when it comes to your patients. So strike a balance between giving just enough information and absolutely make sure that you avoid any gory details. You have to remember the patient is not there to learn dentistry. The patient doesn't want to become a dentist. The patient is only interested in the outcome, and the outcome is not dental implants. The outcome is receiving a restoration on the dental implants. So that is the reason why the patient is there with you. So spare him all the intricate details of the surgical procedure. Over here, some studies have reported that making use of three-dimensional animations is significantly better at conveying the steps of the procedure as compared to maybe say using a pamphlet. But personally, for me, I think even showing an animation is, it can become too scary for the patient because they have no idea of how the anatomy works. So what I usually do is I follow the rule of three. So I always try to divide the information into three parts because it is easy to remember. So I tell them that there are only three steps. The first step is we will give you local anesthesia, which is similar to, which is exactly the same as the anesthesia that we give you when we extract teeth. So this immediately establishes a sense of comfort and familiarity because they have always heard of people who have undergone extractions. So when you tell them that the same anesthesia is going to be used, they get that reassurance that implants are no different as compared to extractions. Then I tell them the second step will be making space using specialized tools. So avoid using the words drills and avoid using the word hole. You are not making a hole and you are not using drills. You are making space using specialized tools. So these softer words reduce the burden, cognitive burden that your patients will have to bear when they are trying to imagine what the procedure will be like. The third step I tell them is we place the implant and sometimes give you a tooth on the same day. That's it. That's the end of my description. I usually refrain from showing them any kind of animations or pictures unless requested. I've already shown them the model of the implant, so usually they have a reasonable idea of what that will be like. But in case if someone does ask you to send them some kind of link to watch an animation, be aware that all the implant manufacturers like Nobel, Straumann have a section on their website which is devoted to patient information. So go through the websites and have these links ready so that you know that the patients read information from the right sources. The next question patients will ask you is, how much time will implants take? And a lot of times you will come across people who have lost and have been missing their teeth since years together, but the moment you tell them that to receive a crown on the implant you will have to wait for a period of 2 to 3 months, they suddenly go all indignant on you and they start telling you, my goodness, 2 months, do you expect me to wait for that long, really? And at this time it is very very tempting to kind of point out that, well, you were without a tooth for all these years and you never felt any kind of rush to get your tooth replaced. But try to avoid this. Try to understand what is actually the context of this question, what the patient is trying to ask out of you. Actually, the concept of time is very relative. If you are doing an activity that you love, time will pass by very very quickly. If you are doing an activity that you don't like, time will pass by very very slowly. Time also passes slowly as you age, and that's a real fact. So remember that mind time and clock time are two totally different things. So what the patient is trying to estimate here, by the way, let me just make it clear that the patients do not like undergoing dental treatment, so they are engaging in an activity that they don't really look forward to, and which is why what they are trying to estimate is, how much time will this unpleasant chapter remain open in my life. Now, what you have to tell them here is, and this is what I actually say, I tell them that within the limits of biology, I will deliver your tooth in the quickest possible time frame. Sometimes that means I will be able to deliver your tooth immediately. Sometimes it means that I will decide to wait for a few months before I deliver the tooth. But know one thing for sure, I am working to deliver the tooth at the earliest possible time while staying within the limits of biology. So just give me 1 second. I'm just gonna close a few applications. And let me just reshare my presentation with you. So
Ashutosh, we have lost you.
The lag bit.
sorry for that.
Srishti, can you please look in? Yeah.
Yeah, I'll just share the presentation once again.
Yeah.
So can you see this presentation now, ma'am? Is my presentation visible, ma'am? Yes. Okay. I'll just go ahead and continue. So my apologies for the interruption. This is the disadvantage of living in the era after COVID. So which compels you to make all kinds of adjustments and do all these presentations online. So just to circle back, what I do is I reassure them that within biologic limits, I will deliver your tooth in the quickest possible time frame. One thing to avoid is avoid confrontational language, which reminds them that they were tolerating edentialism all along, because it doesn't help anyone. It doesn't help you, nor does it help anybody else. So avoid all kinds of confrontational language. Just tell them that you are trying to do your best to deliver truth at the quickest possible time. One more thing that I tell them is you don't have to make the effort to remember all the timelines. I will place the implant. You will receive a call from our office reminding you for the next appointment. Until then, you don't have to have it on your radar. You don't have to remember anything. So the cognitive effort is taken away from the patient. Now, the most requested and most questioned part, which is how much will implants cost. So a lot of questions have come to us before the presentation that our patients ask about the fees, and that's a sensitive issue. And how do we go about discussing fees? So now you have explained what an implant is. You have explained all the procedure. You have explained the nitty-gritties of it, and the patient is essentially in this mode right now. But you've given me all this information. But how much will the implant cost? So the first question that they ask you, and which honestly we are not always very comfortable to answer, is how much is it going to cost, doctor? So the key here is to remember that the important aspect is not the actual answer, but it is how confidently you answer this question. So it is actually how you answer this question rather than what the actual answer is. If you are offering a premium service, about that there is no doubt. You are offering a device which is made with sophisticated technology, which takes a lot of training and equipment to place. So it is a premium service. It is not going to be cheap. So never answer this question with hesitation or doubt about the worth or value of implants. You have to remember there is a difference between unnecessary treatment and discretionary treatment. Implants fall firmly under the category of discretionary treatment. It adds value to the patient's life, and that is why always be confident when you are discussing the costs. The way I typically discuss costs or fees is I usually give them an analogy of what an implant fee is usually comparable to. So I will typically tell them that this implant is likely to cost you as much as having to buy a smartphone. So they have a reference for a smartphone in their heads because they have already explored and probably bought a smartphone or two in their lives. So this makes it a little easier for them to kind of get an idea. Typically, if they are interested, whenever you give an analogy, they will ask you which smartphone, or if it is a full mouth treatment and you are comparing it to the cost of a car, they will ask you which car. Now when they ask you this question, you should have an answer ready. You should have the exact make and model ready, which you can talk about and which you can mention that this is what I am talking about, this is the expense that you are likely to get. But always also remember that the moment they ask you which car, that itself means that the patient is interested in getting that treatment done. So whether they say yes at that point or not is not the point. They definitely have indicated that it is they're interested. The second question is, nowadays this is getting very common, will my insurance cover it? Just circling back a little to the previous one, how much is it going to cost, doctor? So there are different terms that people use to describe the term fee. Always steer them back to the term fee. It is not cost, it is definitely not rate, it is fee. And the reason why it is a fee is because when you say the word fee, it includes intellectual capital. If you go to a car mechanic who changes or replaces a part inside your car, there is a fixed fee or a fixed rate at which it is done. That is not the case with dentistry. A dentist who has a very high level of skill can decide to charge more than somebody else. So this intellectual capital is inherently included in the word fee. So you always have to steer them back to the word fee. Don't use the word cost, or don't use the word uh, rate for sure. The second aspect of it is, will my insurance cover it? Now, the truth is, in India, a lot of dentistry so far is not insurance driven. Personally, I like it that way because the very word cover, what do you mean by insurance covering it? It almost feels like the patient wants to pass on the responsibility of managing their health to someone else. Now you have to remember, health insurance is not like vehicular insurance. Vehicular insurance is very specific, and it actually can take care of almost everything that can happen to that, or that can go wrong with your vehicle. Health insurance is not like that. So the key here is to steer them away from this word cover and to steer them towards the word benefit. What are the benefits that are offered under the word insurance, or under your insurance plan? So what I usually do is, even if the patient asks me the question, will my insurance cover it? I will usually answer, from my experience, most of the insurance plans in India do not have the dental benefit, because that begins to let them know that the responsibility of spending for your dental care lies with you and not with your insurance company. Then I go ahead and tell them that if you wish to, I can present to you a copy of the treatment plan or sequence that we have for you, and you can try and submit it with your insurance company. But from my knowledge, the insurance plans in India rarely cover dental benefits. So this is how I tackle the question of insurance related queries. The third query, which we don't like to listen to, is, why are you costlier than the next door doctor? And they will typically come up with things like, but that doctor charges much lesser than you. Now you have to remember that this patient who's basically saying that the next door doctor is charging you less, charging them less than what you are charging, he or she falls under two categories. One, he's just a tough negotiator, and he or she likes to eke out a good deal out of every single situation. Number two, this patient may just be looking for the cheapest possible dentist. Now, if you are in the business of offering the cheapest possible dentistry, then whatever I am advising you is not relevant, because then your only plan of action is to find out what the next door dentist charges and charge lesser than that. But let me tell you from personal observation that this is a race to the bottom. It's a downward spiral that we all engage into by charging lesser and lesser and lesser and lesser, and the quality of care in the end goes down, and the reputation of dentistry as a profession starts suffering as a result. So if you are really into the cheap dentistry spectrum, then your plan of action is going to be very different. But if you are not, then, and if your patient belongs to the first category of patients, which is he's just a hard negotiator, then you have to remember one thing, that this patient is very comfortable with making you uncomfortable. They are good at negotiating, so they are very good at making you uncomfortable. So don't give them that joy, don't give them the pleasure of being seeing that you are uncomfortable with their question. Answer it very simply. And the way I say it is, if the difference between my services and the services at other clinics is only the cost, and there is absolutely no other difference that you can see, then my advice is, go ahead with the dentist that charges you less. The moment you say this, it suddenly puts them on the back foot, because you are being very willing to let go of them as a consumer or as a patient at your clinic. So this is usually my response to, why are you costlier than the next door dentist? The question that I personally hate is, can I get a discount? And but the truth is, bargainers are everywhere in the world. You will always come across people who want to try and see if they can get a good deal out of something. It took me a long while to recognize that it is not personal. Their question is not personal. One should not take it personally. It's just their way of living. So The way I go about it is I tell them, if costs were not a barrier at all, would you be willing to go ahead with the treatment that I have explained to you? If they say no, then that means that your explanation is falling short somewhere. So you have to then ask them, did I do a good job at explaining you the treatment plan? Don't ask them, have you understood the treatment well? Because they will say, yes, I have understood, even if they haven't. You have to ask them, did I do a good job at explaining the treatment plan to you, or should I try again? Now, if they have understood the treatment that you are explaining and they still want a discount, then for me, it's a very simple question. I counter question them. If I offer you discount of 0 rupees, will you still go ahead with the treatment at my clinic because of the way in which we work? And if they say no, I usually don't go ahead with that patient, because an implant patient is married to you literally. They are there with you forever, and that kind of relationship just doesn't work for me. If it works for you, you can go ahead with it. But that's typically how I take care of the discount related queries. The actual question that is valid here is, how long will the implants last? This is a very valid question, and the patients deserve to know it, because they are spending an inordinate amount of money on a treatment that they had never heard of. So I usually compare the implant success rate with the other implants in the body, which is the hip implants and the knee implants. Thankfully, 20-year follow-ups of hip and knee implants usually show that their success rates are between 85 to 90%, whereas the dental implants show a success rate of 93% over a 20-year window, and that is good enough for any kind of patient to understand and accept. So this is typically how I take care of the how long will the implants last question. So here what we need to remember is, we all grew up watching Hrithik Roshan become a superstar in one night. But the truth is, medicine and dentistry are not professions where you will achieve quick fame. It is not possible. So our job here is to ensure that we do the job of explaining the treatments. We may not necessarily attain wealth very quickly, and we have to be okay with the fact that that is how our profession is, because that allows us to dissociate from the patient's yes or patient's no. The third bucket is the why of dental implants, and that is, why should I choose implants over other treatment modalities? And the answer here is, implant supported treatments offer an improvement in the quality of life, QOL. So patients expect implants to restore normality, which is they want to feel normal after their tooth loss, and that is something which implants are known to offer. Compared to RPDs and FPDs, implants provided an approximately 40% improvement in oral health related quality of life. So you can tell them the comparison with the different options that they have got. So the first option is FPD. The first point that I put forth is the survival rate. So survival rate of FPD after 10 years is 50% versus 97% for implants. 80% abutment teeth were intact before getting prepared for an FPD, and caries is the most common cause for FPD failure. 30% abutment teeth fail after 15 years and 15% require endodontic treatment. So when you are comparing FPDs to implants, you can use success rate of implants as the reason why people should choose implants over FPDs. When it comes to removable partial dentures, I usually make a comparison between a 20 kilo gunny sack of rice versus a watermelon which is 6 kilos. The fixed replacements can allow you to apply forces close to 20 kilograms, whereas the removable replacements will allow you forces only up to 6 kilograms. And that's a huge difference between the amount of force that you can apply. So RPDs are like the 6 kilo watermelon, and FPDs or fixed replacements with implants are like the 20 kilo gunny sack of rice. 5-year survival rate of RPDs is 40%, 10-year survival rate is 20%. After 10 years, 80% abutment teeth show increase in mobility, plaque, bleeding on probing, and caries. 44% abutment teeth are lost after 10 years, and only 60% people continue to wear removable dentures after 4 years of delivering them. So this is why you can communicate to the patient that it's always best to choose a implant supported or a fixed replacement over removable partial denture. So our trump card here is, you can apply more force, and the success rate of implants is more as compared to removable dentures. Complete dentures. This is an interesting scenario. When you have natural teeth, 90% of the food that you chew passes through this number 12 sieve, which has holes that are 1.7 millimeters in diameter. On the other hand, after tooth removal and after receiving a denture, within a 15-year time frame, only 58% of the food passes through this sieve. So a decrease of 10-fold in decrease in force and 40% decrease in efficiency, which affects the patient's ability to chew. In fact, 29% denture wearers are only able to consume soft foods, 50% denture wearers avoid a lot of foods, and 17% denture wearers claim that they can eat more efficiently without the dentures, just like my grand aunt. That is the reason why the business of dental adhesives is booming, and the market of dental adhesives is greater and greater, which allow the dentures to be retained. So the trump card that we have here is implants allow retention. So retention is our trump card in complete dentures, and they also allow the patients to apply the force uh, that is possible. I usually use models to demonstrate what the treatment will actually look like. And the reason is we all love test drives. In fact, nearly 3 in 4 adults end up buying a vehicle after they test drive a car. And those who are looking to buy a car immediately are usually likely to buy the car on the same day. And people like test drives or in all kinds of aspects of their lives. In fact, Indians are the people who take the maximum number of test drives when it comes to cars. So the same analogy extends to dentistry and implants. So have these nice models ready with you, which can actually demonstrate to the patient what the end result will feel like, because it is very difficult to imagine it otherwise. The other point that I mentioned is the bone is going to go on reducing, and this is a nice, excellent diagram that actually tells them the bone levels 2 days, 5 years, and 21 years later. And you can then tell the patient that the appearance will become senile. So that gives them an idea of what exactly they are looking at if they don't replace their teeth in time. So bone saved is bone earned. But over here, remember that there is an old adage in implantology. The patient's yes is or patient's willingness to get an implant is inversely proportional to the availability of bone. So a lot of times you will encounter when there is bone, the patient will not say yes, and when the bone goes away, the patient will suddenly want all kinds of implants. One more point that I mention is you will save a lot of money if you place an implant. Patients will typically spend 25 times more than their initial investment if they get a fixed partial denture when you account for all the repairs, retreatments, and eventual loss of tooth. So the break-even time is 7 years. After 7 years of receiving an implant-supported restoration, the savings that happen because of FPD get offset by and the initial higher cost gets offset. So the break-even point is 7 years. So you can share all these statistics with the patient who is very cost conscious. Now we come to the final bucket, which is the should I of dental implants, and that deals with, do I really need implants? Can I do them later? And can I think about implants? So the answer to all these questions is yes, you do really need implants. Otherwise, I wouldn't be offering them to you. And yes, you can do the treatment later, because nobody dies of not getting an implant in time. Can you think about it? Yes, you can think about it. Now, the way I go about answering these questions is you do really need implants and you can do it later. But the truth is, the longer you wait, the more difficult the treatment is going to get. Because unlike other areas of the body, teeth don't heal themselves, which is why it becomes more difficult, more expensive, more effort intensive as you wait longer and longer. So you can wait, but you shouldn't. Can I think about it? Yes. I usually tell them this is actually a valid point. They can think about it. It's a big decision. They need not make it at the same appointment. I usually leave them with the next appointment already made after a week or so that I have a follow up with them. And the second thing is I share a link with the resources that I know they can browse and they can get the right information from. So typically, like the resources that are available on the implant company's website, for example, Nobel Biocare. So parting thoughts for the patient are, in McGill University in 2003, 30 patients with mandibular implant supported prosthesis and opposing maxillary complete dentures were studied. Just 6 months after implants were placed, their vitamin B12 and hemoglobin and albumin level went up, body fat in the shoulders and arms increased, which is the right place where the fat should be, and body fat around the waist decreased. So they actually resulted in systemic improvements in the patient's health. Parting thoughts for you as the dentist. In India, car sales grew by 9.2% in 2017. The total number of cars that were sold in 2017 were 3.2 million. In 2017, there were 251,000 dentists that were registered in India, which means that for every dentist, 12 cars were sold. So if you are sitting there and thinking that no, my patients really can't afford dentistry, I just want to ask you, do you really not see even one single person around you buying a car? Because we believe that it is about the costs, but it is actually not about the costs. It's just about the priorities. So with that, I have already overshot my limit by a few minutes. I will quickly conclude. Uh, will all patients say yes? And let me show you an OPG of a distant relative of mine. And he was in his early 70s, absolutely fit, no medical conditions. And as you can clearly see, he needed sinus graft procedures for receiving implants. So after presenting all the information to him that he needed to know, he told me, I don't want it. He made that face that only your relatives can make and told me a point blank that I don't want it. And then I asked him why. And so then he said that after you reach a certain age, there are some things which you just don't want in your life. So this is one of those things. So suddenly I realized that we believe that we know our patients, but maybe we don't. Maybe for someone this is really not the priority. So my last parting advice to you is, don't be afraid of your patients no. We are very scared of this word no. We don't want to hear it from anybody. But don't be afraid. There are times when our patients are genuinely not in a situation to say yes to our treatment recommendations. But what I want to tell you is, a study of interviews with 50 edentulous subjects found that tooth loss was comparable to the death of a friend. So, tooth loss is a significant event in any person's life. So, present your treatment confidently, present all the options, give them all the information. A patient for whom right now it is not possible to say yes to implants, maybe at a later point he may reach a stage where he can say yes. Maybe your paths will cross again, and you will be able to go ahead with the treatment that you have planned. So go into a treatment plan presentation with equanimity. Don't be attached to the patient's yes. 60% of our patients say no to dentistry because of costs. And the reason why I put up this statistic is because I am sure you experience this in your practice. At least a large contingent of patients are going out of your practice because of costs that are associated. My point is, what about the remaining 40%? The remaining 40% are saying no to dentistry because of reasons that have nothing to do with costs. This is the population that we have to communicate our treatment plans with. This is the population that deserves to know what are the different treatment options and alternatives. And that is the reason why my suggestion to you is, diagnose the patient's dental condition, what you are trained to diagnose. Don't diagnose their capacity to pay. So with this parting thought, let me show you, this is my practice. This is where I work with my wife, who's a prosthodontist, also from Nair. You can connect with me on Facebook at this address. And with this, I would like to conclude my presentation. And I would like to welcome any questions if we have the time for those. So over to you, moderator.
Thank you, Ashutosh, for that wonderful presentation. And
Thank
there
you,
may
ma'am.
be a cue to pick up from your presentation, because many times we don't know the depth of the words that we talk, and hence
Yes.
it's not conveyed properly. And the patients do understand when we tell them properly. And
Yes.
thinking about discounts, even we as professionals, when we go to some another professional, we expect that after the consultation, let not one tube of something be given to us. So
Yes.
everybody
Yes.
likes to it, but that free has got a very big cost, because anything that is free is costlier than what it actually is. Like, say,
Correct.
if they're going to offer you a free wafer packet with something
Yeah.
bought, you are costing your health for it. If
Yes.
somebody is allowing you to free watching something, you are actually giving them your valuable time of your life. So everything
Certainly.
that comes free is actually more costly. So it
Certainly,
was a
certainly.
really lovely presentation. Nice to hear you, and thank you
Thank you.
for uh, being prompt enough to agree to whatever we called you for the presentation. Now, among the
Thank you.
questions, we have two questions that is coming in. One is,
Right.
how did you convince for any additional procedures like soft tissue grafting in second stage? How do you convince your patient for that? And the
Hmm.
second one is that it's a very, in your personal practice, did you have any challenging case and how did you go about doing it?
So I will answer the second question first, if that is okay.
Yeah, yeah, fine.
Yeah. So the first challenging case that we faced in our practice was when we encountered a patient who had come to us with a complaint that I have sensitivity in one of my tooth. That's it. That was his chief complaint. Then we took a look in his mouth and we noticed that he had a wear facet, and that was actually an erosive wear facet. So he had acid reflux, and that had led to the erosion in his mouth. Apart from that tooth, he needed some replacements of missing teeth, and he also needed restorations in the form of maybe composites or onlays, or maybe in some teeth crowns on practically each and every tooth in his mouth. So, and he had come to me with just one chief complaint: I have sensitivity in one tooth. So the challenge that we faced at that point was that now we can see that this patient is in need of a full mouth rehabilitation. How do you communicate this idea to him that, buddy, you are in for a long haul and you are going to be with us for a duration of a year or so, and you are going to go through lots of restorations. And he had already visited a few dentists who had done a glass ionomer restoration which had come off after a few days, and so on. So that was when I actually started exploring the science of decision making. How do our patients decide to say yes when they say yes? Why do they say no when they say no? And what are the different aspects to their decision making process? And this is how I came across the process of co-diagnosis, and this is how I actually started implementing co-diagnosis in my practice. So actually, it's a little difficult to cover the entire gamut of the co-diagnosis process, but in a nutshell, what I can advise to whoever has asked this question is, uh, don't be stingy with your explanations. Always be willing to spend the time that it takes to educate the patient. So that the tour of the mouth, that part, that is really really important. The patient has no clue as to what his teeth are actually looking like. So that is the reason why he is only complaining about one single tooth. So you actually have to take the time to take photographs, then bring them on a screen which you both can see sitting next to each other, and tell him that I'm going to take you through a tour of your mouth where I will show you what your mouth looks like. And in a large number of cases, when you put up that occlusal photograph of their teeth, they end up exclaiming, "Oh, is this my dentition?" Because they've never seen it in that way. So that is the first point where you can start gaining the patient's trust and confidence in the fact that you are not just saying something for the heck of it. And that was my first challenge, that the patient did go ahead with completing his full mouth rehab, and it is one of the best cases that we have ever treated. So in fact, the challenge that I faced in that patient was, he was so accustomed to bargaining that on the fifth appointment of treatment plan presentation, 5 times I explained the treatment plan to him. He said to me, I don't think I'm very sure. So at that point I told him, sir, now I have given you 5 appointments. We have spoken for 5 hours. I cannot make you a dentist. I can answer a reasonable number of queries. You can ask me 10 questions and I can answer 10 questions. I can't answer 100 questions, because after 10 questions you have to develop the faith that I have your best interest at heart. Because if that faith doesn't come, then it is not possible to go ahead with this journey of 1.5 years. So then to that he said, sir, I have put faith in you. I have already paid 50,000 rupees to you as a part of the treatment planning process. and he had paid. It was a consultation case, and I was at a consultation practice. Thankfully, that payment that he had made, my friend had showed me. He had showed me that the bundle of notes is in the drawer. So I immediately opened the drawer. I took the bundle and put that bundle of notes in front of him, and I told him, paying money is not an indication of putting faith. So you have to put faith at some point of time. But I did that on the fifth appointment. If you do that at the first appointment, then you have not done enough. So my sincere suggestion is, be willing to spend time and develop rapport. Most of the times, if you do that, the patient will find it okay. But that was one of the challenging situations that I had, and I was saved simply by the a sheer stroke of luck that I knew that the money was there, and that really helped me take care of that situation. Now, the first question is a little more difficult to answer, which is how do you communicate about soft tissue procedures? Uh, the first point that I want to know from whoever this questioner is, or I would like them to ponder upon, is what is the goal for the soft tissue procedure? Because I remember, madam, when we were doing our masters and when we would discuss soft tissue procedures, we would always come across studies which have now unequivocally proven that having width of so and so millimeters of attached tissue is not a requirement anymore for maintenance of periodontal health. So the first thing that I would assess in this situation is, what am I doing this procedure for? Am I doing this procedure for clicking a good set of photos so that I can go home and take a look at them? Or is the patient really does the patient really need and stand to benefit from that process? If the patient really stands to benefit, then the only way to communicate what you are going to offer to them is to show them some before and after photos. No intraoperative pictures, because they contain blood which nobody wants to see. Before pictures and after pictures, and usually I have a library of such pictures with me which talk about the before after situations. That's the only way the patient can visually understand. So the key is to make sure that the patient can visually understand. The other thing that I remember is, there is a Japanese company called Nissin, Nissin, which makes beautiful demonstration models for various treatment procedures in dentistry, including soft tissue procedures. So their soft tissue models actually have soft tissue that you can pry apart and you can show the patient. So those are but they're expensive, but you can invest in them if you really are into those procedures so frequently. Usually explaining about sinus grafts is not that tough because it's something which the patient can instinctively understand. So I hope that takes care of the gamut of queries that the person may have asked. But that's kind of my broad advice, that you have to make sure that you have before after pictures. Pictures is the key to communicating what you are trying to show.
I would like to add upon that. Even today, if you see, dentistry is more of aesthetic. Functional
Yes.
comes second only. They're more of aesthetic. They want to look good, or we think of both functional as well as aesthetic. That also brings me to another point, saying that we spoke about masticatory efficiency and masticatory capacity. We don't have to
Correct.
have the whole of 32 to really chew and eat.
No.
Without the teeth, also people can eat, and that is why this problem does come again and again. That they really don't want to chip in for something which is.
So if I may add for a little while, it's already 10:31. Uh,
Yeah.
in fact, when I present removable partial dentures and I tell them that the masticatory force that you can apply is equivalent to picking up a watermelon, which is 6 kilos, I usually follow it up with the fact that that will be enough for you to consume your regular food. So rice, chapati, sabzi, everything, all these things can be consumed with your removable dentures also. So the point here is to not convince, or I hate the word convert a person. The point is to leave them with enough information so that they can make an informed decision.
Decision. True,
Yes.
true. Very
So
true.
you can only tell, you cannot sell, because we are
True.
dentists, we are not businessmen. So that's the kind of point that I would like to make here.
Thank you very much, Ashutosh. We'd like to place our token of love and appreciation to you by presenting you to this certificate, which will come to you in due course.
Thank you, ma'am. Thank you. It was an honor and a privilege to get to present and share this screen space with you. I will probably take a screenshot of this. Thank you so much. Thank you very much.
Yeah, it was our pleasure too. Thank you.
Thank you, ma'am. Thank you.
Go to the next presenter. And with that, we come to the next presenter for the day. The next presenter for the day, we have Dr. Rajiv Chitgupi. Dr. Rajiv Chitgupi is a research and a marketing head of the ICPA Health Products Limited. He loves and is passionate about product innovation, branding, and marketing. He hosts a number of online shows for ICPA, and throughout the pandemic, he has kept himself and everyone busy by putting up a lot of series of clinical talks to reach out to almost maximum dentists all over. And he is also a developer of Perio Economics. He is also the executive editor of Dental Tribune South Asia, through which he spreads the know-how of simple techniques and concepts in print form. He has been a wonderful guide and counselor to several graduates and postgraduate students in helping them making decisions in collaboration with different career guidance setups. Today, his talk will facilitate you your practice build up, your practice management, and to reach out to your goals further. Over to you, Dr. Rajiv.
Thank you, madam. Thank you, Dr. Mala, madam. And I thank Nair Hospital Dental College Department of Periodontics for giving this opportunity. And I absolutely loved Ashutosh's talk, the way he put forth so many concepts, and I'm sure the audience had a great time. Okay, coming to my presentation now. Let me share my screen. So my talk is on this topic, personal branding in healthcare. Okay, so I want to remove some of the myths and misconceptions, how people look at branding, what they understand by marketing, and I want to show them different opportunities they have in their hand. And I want to give you all very simple tools that you can make use of, and by remaining consistent with simple strategies, how you can build a great brand around yourself. All right, let us begin. Branding in healthcare, especially in dentistry. The moment I say this, there is a different kind of perception that enters a lot of people's minds, and that is visible in the kind of questions they have asked in the Google form. So when I say branding in healthcare or branding in dentistry, first thing that comes to their mind is dental clinic. They themselves, the person doesn't come in the picture first. Branding in healthcare, branding in dentistry means my dental clinic. Immediately there will be a social media agency which is given or outsource the work, and they prepare a monthly calendar, and then starts continuous flow of monotonous posts. Okay, all of them are so similar, very little variety, and they serve very little purpose. Let us see some examples. I have given an imaginary name. I wanted to give some imaginary name which is not taken up by any clinic. Okay, but most of the names are taken, and all those posts they all look like this. Okay, November it will be Diwali post, December it will be Christmas, then it will be January Happy New Year, and then it is Holi. And these templates are available everywhere, and on top of that the clinic logo is put some imaginary name. So I wanted to put Apple Dental Clinic, but I think Apple Dental Clinic also taken. So I have given an imaginary name, Mango Dental Clinic. So this will be there everywhere. So what do you think? What purpose will this post serve on Facebook or Instagram? Okay, the person who has got this done, who has paid for this post for his clinic, is very happy, very proud that this post is looking so good, and he sends it to all his friends on Facebook, on WhatsApp, his own group of dentists. And what is happening on that day? Their friends are already overwhelmed by thousands of such posts. They are not even opening their own friends' genuine wishes, because there are thousands of them. And many of them are not even opened for 6 months. Sometime later they are opened. And this person has with such great pride and love. He has put his logo and he has sent to people so that they can see his wish, they can see his logo, and the purpose gets defeated. No, it doesn't just get the visibility he's looking for. So now you tell me, everything is good here. There is an occasion, and the person is making a wish, wishing good for the other person, sending it to a person he knows, but the other person is not reading. Why? Because the intention behind this post is understood. There is no real value being generated. Today, everybody gets so many posts unless something really catches my imagination, unless something really engages me, unless something really creates value for me or solves my problem, I will not pay attention to that post. So, as a routine, as a monthly calendar, these regular things that are being done, they really don't yield any value. This is my first take home message for all of you. Now, there are some agencies that are slightly more creative. Okay, so they create a few, a few steps ahead. These posts are a little more creative. So comment below. They are asking for some point of action. Some call to action is there. Comment below. Which do you use? Manual toothbrush or electric toothbrush? So it is asking the audience to take some action. Or there is some wordplay. Be kind to dentists. They have fillings too. Or some other type of wordplay. Smile, it's tooth day. But there is a limit to this. There is a limit because these have been done, redone so many times, and the audience has already seen it. Who is the audience? Who is the audience? Your patients, the common public. Okay. So dental clinics are taking these general public, common people on their Facebook pages and putting these posts. But are these posts getting visible to the followers? Not to all of them. Not to all of them. If your Facebook page has 1,000 followers, don't assume that your post will be visible to all 1,000 of them. Facebook does not show. So unless and until you pay Facebook to show to all my followers, it will not show. So what I'm telling you is there is a continuous exercise that is going on everywhere with social media posts. It is like we have to do this, whether people watch it or not, whether it is visible or not, whether it engages it or not, but to keep an identity of our social digital footprint, what we can say is a digital presence of our clinic, we have to keep on posting these posts, keep on publishing these posts. This exercise is happening. Dentists are paying social media agencies, they are creating these campaigns, but the result is very little. Result is very little, and this is one problem we understand today, and we'll come up with solutions which are much simpler and much more result yielding than what you are already doing now. Okay, so let there be no monotony. Don't go after these posts. Instead, you can develop newer strategies that I'll be showing in today's lecture. So what are we creating? Even though we are dentists, we are trying to create dull, corporate, faceless brands. Your patients are coming to you, they know you as a person. Instead, we are creating dull, corporate, faceless brands, which is not giving you any results. In fact, the actual corporates are giving human touch. See the irony. This is Zomato. So of course, Zomato has a highly creative team, that Akshar Pathak and all those people. Okay. So everything, even one-liners, such short one-liners. Okay. One of their tweets, "Kabhi kabhi ghar ka khana bhi kha lena chahiye," was one of the most popular posts. Even in fact, their MD or CEO asked who made this post today. Everybody had liked it. Okay. This was on Jan 26th. Breakfast can wait. Pehle parade dekh lo. Okay. And currently trending topics. Pushpa is trending. So they have made an ad using the same guy, using the same action, same hero, same action. So there is relevance, there is context, and there is connect. Okay. And see this, Jan 23rd. You are your pet's Zomato app. So your pet at home will tell you to get the food what it wants. So this makes you think. Thought-provoking posts, that give you that personal touch, that give you that human touch. So if you are looking for some kind of different campaign, if you want to be creative, where you want to have more engagement, and if you have been worrying for the last 1 and 2 years, 1 or 2 years, I've been paying a social media agency. They are carrying out my social media marketing, but I'm not getting those kind of likes, shares, comments, engagement. There is one like, and if I go and see those 10 posts, it is the same person who is liking all these times, and many times it is the same person who is a part of clinical team who is liking those posts. Okay, so this is not happening. But whereas here, Zomato is a corporate company, but they are trying to become human. Clinics which are actually human are trying to become corporate. So second take home message of the day: don't try to create dull corporate faceless image of your clinic. Okay, you have given your clinic a name, you have given your clinic a logo, a color, there is a color palette, everything you have worked on it. Okay, let that be there. I'm not telling you that was the wrong choice. No, that has to be there. But start giving human touch. Without giving that human touch, your all other branding exercise, all your marketing campaigns will not give you the kind of result you are looking for. So this is called as the idea of human touch. You can Google it. You can take screenshot of this. Do whatever you want. I will just want all of you to take benefit from this lecture, because the more and more number of dentists start using my idea that I'm giving in this lecture, that much benefit will come to the industry. The more the industry grows, the more we will all grow. Okay, so that is the whole idea behind this lecture. So this is the idea of human touch, or it's also called as the concept of humanization. You can Google this. All of you who have this digital marketing happening, doing digital marketing for your clinic, enterprise, your academy, your dental material company, whoever, I don't know who are all watching this lecture today, understand this concept of humanization, how you can give human touch. Okay, but for clinicians, the human touch already exists. Okay, suppose you are a dentist, I'll give you a fictitious name. Suppose you are Dr. Michael Jackson. Your patients, the people around your clinic already know you as Dr. Michael Jackson. No, don't unnecessarily force a different, very difficult brand name on them. Okay, so when somebody calls your clinic, okay, let that person say your name only. Hello, Dr. Michael Jackson's clinic. So immediately he remembers. Okay, don't say that welcome to peri-implantitis clinic. I don't know he will whether he'll even remember how to pronounce that word or remember the name that you are suggesting him to remember. Okay, so I am telling you, make your exercise simpler, make your exercise effort simpler and more reward yielding, because you are dealing with your customers. It is those people, it is the community that should find the entire exercise beneficial. Okay, so maintain the personal human touch. Various examples that I'm going to share in my today's lecture will all cover this human touch, which is very important, which is unfortunately being neglected because everybody tries to follow certain stereotyped internet laws. Okay, so everybody thinks this is the protocol, let us follow this has to be done. Okay, that will give you discipline, that will give you consistency, but ultimately your message should have some soul, it should have some emotional connect. If you have that emotional connect, then you talk about any complicated topic, your audience will understand. But if you take a very simple topic and don't give it that emotional touch, the purpose gets defeated. This is exactly what is happening with all these festival wishes. Okay, they are very monotonous and they are not giving that emotional touch. Okay, now let us take one more question. This is a question that has come. There are many questions around this along the same lines. I have just condensed them like this. Is personal branding needed? Our senior dentists never did. Okay, another question: why should we do branding and marketing? Dentistry was not like this before. Before? Which before? Which era are you talking about? Are you talking about 1950s or 1960s or 70s, 80s? 90s, or the current era, 2000 plus. People who are trying to compare to old dentistry, they don't want to go back to the old instruments. They don't want to go back to the old patients. They want to be relevant to the newer population. They want younger patients to come to them and ask for smile design. They want younger patients to come and ask for high end aesthetic treatments. They want people to come and ask for full mouth aesthetic rehabilitation. So when it comes to today's beneficial trends, they want to go for that. But when it comes to branding and marketing, which is actually required for your customers who are always on mobile, trying to check reviews, testimonials, based on which they want to make their decision, here dentists are trying to ask whether we should be doing branding and marketing. Is it ethical? Why is it not ethical? If you don't do this, you will become irrelevant. Here, there is a difference between these words, branding, marketing, and there is one more word. I'll tell you the difference. Once you understand this difference, all your, what you can say, confusions about the ethical concerns will disappear. That is the main motto of this lecture. I'll make you very, very comfortable with branding, marketing, and all other online strategies by which you will start reaping rewards for whatever you are trying to do in digital space. So, what I'm trying to tell you here is you are trying to utilize all modern technologies, you are trying to apply all modern treatment concepts, you want modern thinking audience, customers who are ready to pay, but you are questioning the modern marketing ways. Why? See, it is the evolution of the entire ecosystem. Everything has evolved. So you need to evolve. If you don't evolve, you will perish. Okay. Now, let us look at it in another way. Why branding and marketing? Dentistry was not like this before. People who are asking this question, they saw this ad on their smartphone, ad of this lecture, flyer on their smartphone. They saw this post on WhatsApp. They have registered for this event using a Google form and they are watching it online right now. So we are making use of all modern tools and devices and technologies. So the whole ecosystem has evolved. Similarly, branding and marketing has evolved and it is going to evolve even more. So the key element here is acceptance and alignment. You need to align with the way the society is evolving. Okay, so the way it evolves, laws will also evolve. Everything has to modify. When we were in hostel, that time it was illegal or what you can say, not appropriate, whatever word you can put, it was not allowed to keep a computer in the hostel. Okay, it had just come, internet had just come. Now can you imagine any hostel room without a laptop or a mobile? Impossible. So there will be some teething problems in the initial years, but ultimately the laws will catch up. Ultimately it will be accepted. So the person who is prepared for tomorrow will end up doing much better. All right, let us see some examples. As I told you, corporates are trying to become more human, whereas clinics who already had human touch are trying to become corporate. Now, let us see some of the leading examples, how these people have understood what they are doing and how clearly they are sending out the message to the community and the customers. Goldstein, Garber, and Salama, okay, one of the top-notch dentist group in USA. When it comes to their clinical practice, okay, when it comes to their clinical practice, it still says Goldstein, Garber, Salama, okay, Atlanta dentist. You can check the Google, the first page where they come. Everywhere you go to their LinkedIn, Goldstein, Garber, and Salama, their website, wherever you go, it is the same name. So they are known by the dentist's names. It is easier for the customers, the patients, and the community to remember, because they are going to get treated by these people. But the same team also has a venture in online education. It is Dental XP, which is the short form of dental experts. But on this online platform, it is not only this team, but experts from all over the world come and they teach. Okay, they conduct online teaching as well as offline programs. Okay, offline courses in their own Dental XP Learning Center. You can subscribe to this, one of the most amazing platforms. Look at this. Maurice Salama is a part of this. He himself is one of the in the founder team, and these are people from different parts of the world who are part of this online teaching program. Here, the name is very suitable, Dental XP, because there are a lot of people who come and teach. So this brand has evolved. It has become big thing in today's time. So they have clearly differentiated their own clinic where the name is of the dentists and where their educational venture. Here it is defined by the mission. Dental XP, it defines the mission. It creates dental experts. They are creating experts. So the message is clear and the mission is clear to anybody who is reading it. Another example. Have you seen this? Are you aware of this person? One of the celebrity dentist from USA, Frank Spear. I'm a big follower of this guy. Okay, even Ashutosh is a big follower of this guy. I want all of you to follow this person, Frank Spear, and those really wealthy people who have really made fortune out of dentistry. Okay, there is so much to learn from him. Follow him on all his social media channels and also open a free account on his website. Okay, also this person has, Dr. Spear has a clinic of his own and he also runs education. Okay, Spear Education. See this, the name is very simple. Everybody knows Frank Spear, so the branding is Spear. So you go to Twitter, it is Spear Education. You go to Facebook, it is Spear Education. And the events are Spear Live. That gives instant connect. You know who you are looking for. Okay. So I want to contact Dr. You can say any common name. You can contact Dr. Bhalla. Okay. I go to Dr. Bhalla. So I want to check Bhalla Dental Clinic, whatever it is. It is so simple to. I don't want to search, I don't even know Shri Siddhinayak Dental Specialty Center.com. I cannot remember this and I'll get stuck in the spellings only, the intricate construction of the URL. So keep it very, very simple. Spear Live, so simple. Spear Education, so simple. What is it? Frank Spear providing education. All right. So what are these people trying to do? These people are trying to make it simple for their customers, consumers, their followers. Look at this, Spear. There is so much to learn from these simple images. Another person, anybody knows him? Dr. John Coyce, another celebrated dentist from USA in Seattle. A lot of publications, actually, Frank Spear and John Coyce were together now in the very old, early initial years, but now they work separately. And I've been following Frank Spear and John Coyce very religiously from many, right from the day of as soon as I got into internet. Ever since their digital presence became very strong online, since that time I've been following both of them, and I've been a big follower of Dr. John Coyce, and I used to read almost all his articles and try to put his content in my courses. There is not a single course of mine where I have not shown Dr. John Coy's picture. So I always wanted to meet him. And I'll just tell you a story. In Mumbai, there is an organization called as Idea Eye. Idea Eye is run by Dr. Satish Bhalgat and his team. And that team, they used to do a fantastic job. They used to invite well-known foreign speakers and they used to conduct events. And they used to be 1 day, 2 day events and amazing events. We have got a lot of value from that. And I've attended almost all their events. And one of the what you can say, one of the important or sought after activities in their events was Lucky Dip. And in my life, I've been very lucky in such things. In lucky dips, at least my success rate in lucky dips has been almost 99%. I've almost won every lucky dip I've been a part of. And in idea events, I used to win almost in every event of theirs. But what I used to win some Dentsply kit or some laboratory prosthetic uh, tool or some kit. I never used to, they were never useful for me. So I used to win and I used to give to my friends, my own colleagues who practice different specialty work. So if I used to get a shade selection thing, I used to give it to polishing burrs. I used to give to my prosthodontist. So hardly, very few of them I have got for myself. But there have been things where there was a Perio book. Okay, Dumitrescu, that book was there for Lucky Dip. And when they announced this book is there, that time only I knew that I'm going to win this book. And that book is still with me. I've read it twice. And because of this continuous winning streak, once the organizers asked me, do you have any speaker in mind whom we should invite? And in the first go, I said, please invite Dr. John Coyce. I follow him and I worship his work. So please invite him. And if he agrees to come to India, I'll be the first person to register. And one fine day, after 1 or 2 years, I got a call that Dr. John Coyce is coming to India. Will you be registering? I said, yes, I'm registering. And I registered. And I happened to meet John Coyce, Dr. John Coyce, and in the lunch, and what an amazing lecture. The morning session was amazing. And in the lunch break, I went and met him. I folded my hands and I told him, Dr. Coyce, thank you. My dream has come true. My dream was to see you. And I'm so happy to listen to you. And this is an amazing lecture. And I look forward to the afternoon session as well. And I told the organizer, Dr. Satish Balagat, sir, I have won so many lucky dips in your events. And today is my biggest lucky dip. I have won everything that I wanted. And if there is any event where I don't want to win anymore, it is today, because I've already won my lucky dip. And that was the first event where I did not win a lucky dip. So the event got over and I went outside. There was a call. I just attended the call and I came back and I saw that everybody's still there in the hall. And I asked, what is happening? Somebody said, no. Dr. John Coyce has announced a surprise lucky dip. And that's why he's trying to pick up a visiting card. I said, what is the price? He said, no. Anybody who wins this gets the chance to come to Coyce Center and do a course of, I don't know, $3,500 or $5,000 course. And after 1 minute of mixing all the cards, he took out and it was my name. So I again won that lucky dip. Then I went to Coyce Center. What an amazing center. Okay, this is Coyce Center. I did perio restorative course here. Okay, and look at the branding, Coyce Center. And what is the mission? Advancing dentistry through science. So here the hero is John Coyce. So the center name is Coyce Center. Earlier the hero was Frank Spear. So the brand name is Spear Education. So utilize these plus points. If there is a plus point, utilize it. Play on your strengths. Branding will be easier. Brand will be created faster. So what you are supposed to do, you are supposed to develop that personal touch. Personal touch is required because personal touch builds trust. Ultimately, everything that you do is a trust building exercise. And here you are dealing with your consumers, you are dealing with customers, you are dealing with community who is always looking for great services, trustworthy services, reliable services, okay, reliable brands whom they can go to, whom they can work with, make use of services and recommend to others. So do things that appeal to your customers. They come back to you and take your services. Let us differentiate different terms now. Let us understand different terms. Your brand is how others perceive your business. Okay, so let us differentiate brand and branding. What is your brand? Your brand is how others perceive your business. What you talk about yourself is not your brand. Your brand is how others perceive your business. Your brand is not what you talk about yourself or what you talk about your business. This basic understanding is very, very critical. So do those things. Do those things which will help others perceive yourself and perceive your business in a better way. Do those things that will help others perceive trust from the activities business that you do. So when it comes to marketing, branding and marketing, I'll tell you the difference. But when it comes to marketing, from all the activities that you are doing, you need to understand three basic levels. Okay, a simple lesson in marketing I'm giving here. Three levels of marketing. Schmoozing sounds like smooching, but schmoozing is first level. What is schmoozing? Schmoozing is when you are inside the clinic and the doctor is talking to you. So whatever discussion takes place in presence, that is called as schmoozing. But there is a disadvantage. There is a shortcoming to this. Clinic shutter is down, schmoozing is over. So it is time bound. As long as clinic is open, you can do schmoozing. You can influence others by your presence. Shutters down, nobody can enter your clinic and schmoozing cannot go on. So we compensate it by social media and website. So your website and your social media accounts talk about you, your practice, your philosophy, even when your clinic is closed. So that is the second level. So first one was schmoozing, second one is social media and websites. The most important level of branding and marketing is evangelism. Okay, the person who made this concept very famous is Guy Kawasaki. Okay, marketing genius who handled Apple in its earlier years, who worked with Steve Jobs and survived even after working with Steve Jobs. Okay, so he made this concept of evangelism popular. Now, what is evangelism? Now, all these hundreds of people who are watching this lecture, if I ask you, do you use iPad? There'll be very few people who will be using iPad. About 10% of this audience must be using iPad. Other 90%, okay, 75 to 80% of the audience who are watching this lecture might have not used iPad. But if I ask them, what do you think of iPad? They say, no, iPad is very good. Then why don't you use it? It is expensive. That's a different thing. But the first opinion that yes, iPad is very good, that perception is always there. So if somebody asks them, I have enough money to buy an iPad, should I buy it? They'll say, yes, please go and buy because it is very good. Why are these people recommending iPad to others? Is Apple paying them? No. Is anybody watching them do this recommendation? No. These people are recommending iPad to their friends even when nobody is watching, even when nobody is paying. This is evangelism. So you are creating brand ambassadors out of strangers. This is the highest level of branding. This is the highest level of marketing. So the more the number of people who talk about you in your absence, that is your brand. This is what you are supposed to do. So this will come only with the kind of experience you give them. The kind of experience you give a lot of people, that generates a brand trust, the kind of experience they wanted. Once that builds in the community, that becomes your brand. This is what you are supposed to create in the community. So let us separate three things: branding and brand. Okay, so branding is the way you want to be perceived. Branding identity is what you create. Okay, all the logo that you have created, the fonts you have used, the kind of name you have given, the colors you have used. Okay, so different color gives different meaning, different perception. So if you look at all the social media brands, Facebook, Twitter, LinkedIn, they all come in this blue range. Blue gives you that feeling of trust. Okay, so there is a different science of color, but all of that will come in brand identity and the kind of tone you maintain in your social media messages, what kind of connect you establish through your words. Okay, and what kind of value you generate, what kind of expression you give. That is your brand identity. What is brand? This is not in your hand. Brand is not in your hand. This is the rule. Okay, the way consumers actually perceive you, it is in your customer's hand. Okay, so it will not happen in 1 day or 2 days or in 1 year or 2 years. It's a collective experience over the years of so many things you do to the community, to your customers. Okay, so this is the difference between branding. So people who are always talking about themselves on social media, okay, what they are doing, they are branding themselves. They may not become brands. Brands are those people who have solved some problems. Okay, of course, if you are talking about yourself all the time, doesn't mean you are not solving other problems. In fact, I suggest you do both. Okay, if you have got some achievement, showcase it. If you have some story to tell it on social media. In fact, storytelling is one of the most powerful strategies on social media. Become a great storyteller on social media. People will love you for your stories. That will give the best human touch. And of course, you are creating brand identity. And together, whatever these do. So you are talking about yourself, your achievement, your personal life, but at the same time, solve other problems. Try to connect with others. Social media is all about others. So do that in balance. Okay, people will follow you for the kind of thing you do for them. Okay, so keep it in your mind. So when you do this and when you keep your brand identity consistent, then over the years your brand will be built. So this is consumer perception. If you are very clear in your mind, this is the kind of brand I want to generate, you need to develop your strategies along those directions. I'll tell you all that. See, these are not vague words I'm telling you. I'll come into the granular details as we move further. I'm just trying to differentiate different terms. Okay, let us answer the next let us give the answer to the next question. Okay, or let us explain the next concept using the same questions that have come in the Google form. Is personal branding needed? Our senior dentist never did it. Why branding and marketing? Dentistry was not like this before. So people who raise these ethical concerns are confused, getting confused between three different terms: marketing, advertising, and branding. These are three different things. Okay, so marketing is when you say that we offer superior customer service. When you tell, if you pay money to three different channels and you ask them to repeat the same message every time, then you are doing paid advertising. Okay, many of you who have asked the questions are concerned about this. I totally get your question. So you are saying, should we be doing paid advertising? No need. No need to do paid advertising. Okay, so you can do marketing through your own actions, and the best way is branding or creating the brand. If your brand strategy is clear, you start solving problems automatically. See here, it is the owner of the business who is talking about himself. Owner of the business who is talking about himself. Here it is the community, the customer who is talking about the business. I know you offer superior customer service. This person need not talk. Okay, just like what I told you for iPad. Okay, strangers will recommend your service to others. That is evangelism. So what is happening here? Evangelism is happening because this person has already become a brand. Okay, so he had his branding strategy, he helped others, and he gave it sufficient time, and over a period of time the brand got developed. So no matter what you are, no matter what you do, you are dealing with your consumers, you are dealing with customers and the community. Do those things that will remember you for the kind of brand you want to build in their minds. So what you need to do, understand their problems, solve their problems, create value consistently, and build trust and credibility. So brand is always about building trust and credibility. So as long as these four things are clear in your mind, you will never do any unnecessary exercise on social media. You will never spend or waste money on exercises that will not help you in the long run. Okay, so this personal brand creation, when we say healthcare, it not only applies to practitioners but also to academics, people who are in colleges, institutes. not only to teachers but also to students and researchers. Who is a researcher? Researcher can be a practitioner doing research in practice. Researcher can be an academician. He's a teacher in a college and he's doing research. A student can be a researcher. Why not? You are doing research all the time. Okay. So you can always create a personal brand. Students who are watching this lecture, interns who are watching this lecture, do a small brand building exercise in your internship. Okay. What is that small brand building exercise? You need not talk about RT-PCR. You need not talk about some new clade of virus. Okay. A small brand building exercise on things that you're already doing. If you love cooking, start writing about cooking. Okay. It's an exercise for 6 to 9 months. You do that. If you don't know how to cook, you love to eat, you start reviewing different restaurants and hotels. If you know how to write stories, start writing stories. If you don't know how to write stories, if you like movies, if you only watch movies, then start reviewing movies. Do anything that you are already doing, that you are already good at. And how to do it? Any which way you are writing about 500 words every day to random people, 500 random words to 500 random people every day. Instead of that, start writing about 300 words on one topic that you really love. Start doing that. Then you see the kind of following you develop. Why are these people following you? Are they following you because you are their friends? Are they following you because you are sending them birthday wishes? No, they are following because you are generating some content which is entertaining as well as educational. You are creating some value for them and you are keeping them engaged. Okay, so do this small exercise. You will realize how brands are built, applicable for anybody. And whatever you do, let there be a mission. People don't buy what you do. People buy why you do it. So it is the mission that is very, very important. If there is no why, there is no reason to buy. Okay, so whatever strategy you build, let there be a why. Then you will see how things start changing. There should be a common theme to things that you do. Okay, so you can check different common profiles. I put myself in very, very common average profiles on social media. I have been experimenting, I have been trying to do different experiments and trying to evolve. The kind of theme I am trying to project is this. I'm showing my first profile. This is LinkedIn. Okay, and today we are in an era of attention deficit. Nobody pays attention for more than 6 seconds or maybe 5 seconds. So in one look, they should be able to come to know what you are here for, what this person is doing on social media. Okay, so if they look at the header of my LinkedIn, it clearly says research, innovation, and marketing. Whatever I do, it is for these three things: research, innovation, and marketing. And what I do, I connect different nodes of dentistry to create opportunities and to fuel growth. So this is my philosophy of what I do. And then here is your profile. I suggest all of you Google what is the maximum number of characters you can use to write your profile on social media. Every social media platform gives you different number of characters. Okay, so this is LinkedIn. I've made use of all the characters. I cannot put a full stop also. I've made use of everything. So what does it say? Researcher, educator. And what is my mission? I'm fostering innovation in dentistry. Okay, fostering innovation in dentistry is my mission. And I'm a growth hacker. I'll tell you what growth hacking is. I'm a growth hacker also, and I'm associated with ICP Health Products. What I do here, I'm trying to build innovative products, cost-effective products which can help healthcare, and I try to come up with newer marketing strategies. I'm also the executive editor of Dental Tribune South Asia. I created 1 million readers in 2 years. Okay, very simple, very easy to understand. And what I can do for you, I help you build your brand in dentistry. So one look, people come to know whether they should follow this guy or not. If they are looking for somebody who will talk about politics, they will not find any masala in my posts. So they will not follow me at all. So this is the concept of micro environment. Use social media to build the kind of micro environment which will help you develop sustained growth for yourself. All right. So there is a reason, there is a way to make use of social media. Any which way you are wishing your friends on social media, on WhatsApp, etc. Whereas when it comes to these platforms, make use of these platforms for the sheer potential they offer. Realize the potential these platforms offer. Same thing I use everywhere. This was my LinkedIn that I showed you just now. This is my Twitter, which it also says the same thing. Growth hacker, fostering innovation in dentistry, marketing head ICP Health, executive editor, dental tribune. Here the number of characters is less. Okay. And I do COVID-19 research. I help you build your brand in dentistry. This is Instagram, growth hacker, fostering innovation in dentistry, marketing at ICP Health, executive editor, dental tribune. I help you build your brand in dentistry. So the moment any random visitor looks at my profile, he comes to know what value he will get from my, if he follows my account. Okay. And I want only those people to follow my account because I want to create value for them. So this is all branding. These are different branding elements. Okay. It's a part of branding strategy. So in every profile of mine, you saw a word called as growth hacker. Who is a growth hacker? What is growth hacking? A growth hacker is someone who uses creative, low cost strategies to help businesses acquire and retain customers. So I try to do creative marketing. I make use of data analytics and testing, and try to do automation. I am learning. I'm not a pro. I'm learning, and whatever I learn, I share. So I've been doing a lot of research and putting things on social media about COVID-19. Doesn't mean I am a master in immunology, virology. No, I struggle with immunology. I struggle with virology. I struggle with basic research. So all the posts that you see on my social media are my struggles. I build audience in the open, building audience in the open through my own struggles. Whatever complex concepts I simplify, I put it on the social media. So my mission on social media is I deconstruct complex concept, make it simplified for people so that they can make use of science. Okay. Some of the branding stories that I have done. Okay. Two brands, Unifloss and Trioplus. I'll tell you how the branding was achieved for these two brands. We had a brand called, there's a floss. We all know there is dental floss. We all know that it removes food particles and plaque from the interdental areas. But who uses floss? Hardly anybody. Floss is very good on paper. The thread is very good on paper. Very difficult to make use of in daily life. People will use it for 2-3 days and they keep it in a cupboard, never used. So when we took this product for branding, I tried to analyze the problem with this product. So Unifloss was the product, and its branding was handy, convenient flossing. Okay. This is the advantage. But the main message that was going, flossing, Unifloss is a flossing method to remove food particles and dental plaque. Okay. When you understand the consumer psychology, user psychology, you will realize that food particle, dental plaque is not the real problem. Flossing itself is the problem. People don't know how to floss. People are not motivated enough to do floss because flossing is difficult. It requires manual dexterity. And because it is challenging, people don't continue the flossing exercise. So here, the problem statement was, plaque is not the challenge. Flossing itself is the challenge. So rebranding exercise was done. What is the rebranding now? What is the branding of Unifloss now? Now we say, come fall in love with flossing. So we try to connect with all those people who tried to do flossing. Means what? Who are those people who tried flossing before, who already knew that plaque is the culprit, who already know that they have to remove food particles from between the teeth, but they were not able to do flossing. Now, the moment we say, come fall in love with flossing, we are solving the real world problem. Now, the acceptance has increased. Trioplast, we had to come up with a name for this product. Okay. So what name was to be given? What does this contain? It contains triamcinolone acetonide. Okay. So it's a steroid cream. But it is not just steroid cream. The product had many more components. What were those components? Gelatin, pectin, and cellulose. Why gelatin, pectin, and cellulose? Because when you apply that, it remains in the same area for a longer period of time. There is much more retention. better spread, mechanical protection, and sustained release. So we had to give a name which will immediately strike a chord. So the name we gave was triamcinolone. The statement we made was, it is not just triamcinolone, it's a triamcinolone oral plaster. Then we made a short form, trioplast. So trioplast is triamcinolone oral plaster. So whatever benefits you provide, they come here. So another principle of branding, I'll tell you, marketing principle: benefits over features. Okay, benefits over features. So never say your pillow is really soft. Say it gives you the best sleep. Don't sell a pillow, sell sleep. Okay. Next, I've been involved in marketing of many educational courses. Okay, so Dr. Komal Mujumdar, some of the brands I've created here. So when we had to create one of the unique courses, implant prosthodontics courses, that time there were no implant prosthodontics courses. There might have been, but they were not so known. So a name had to be generated. So what name I had to give? I put myself in the customer's shoes. Okay, I tried to guess what people asked for. So what generally dentists look for? If I tell them, come and join my implant course, सब कुछ सीखने को मिलेगा ना, implant prosto का सब कुछ है ना उसमें. So they want to check whether it is a complete package. So instead of using a word like comprehensive, we just put complete implant prosthodontics. So this is one of the most frequently run course. Every course is full, more than 30 courses. I think it will be, it has crossed 30 courses. And now the short form, the abbreviation of this is, even that is much easily accepted. It is called a CIP course. CIP is as popular as complete implant prosthodontics. So we made use of a simpler term called as complete instead of comprehensive. Then another course had to be branded. Okay, sinus lift mastery. So what question? Sinus lift के बारे में सब कुछ सीखने को मिलेगा ना? ये कोर्स करने के बाद मुझे करने को आएगा ना? So that question we answered here. Sinus lift mastery. If you do this course, you'll be able to handle sinus lift cases. So keep it very, very simple. Okay. Then, so that they were my examples. Now coming to you people, how you should be doing personal brand creation. Practitioners, academics, students, and researchers, all of you can create it. And as I told you, not through paid advertising, not through any complex marketing, but by doing simple exercises. Okay, and don't confuse your personal branding with your clinic positioning in the digital space. For your clinic, make use of simple tools which are the norms of today. Google My Business. Go to this Forbes article, Google My Business, what is changing and what is not in 2022. Take screenshot of this slide. Okay, then make an easy to navigate website, your website. 6 standout web design trends set to make waves in 2022. And search engine optimization, trends you cannot ignore in 2022. So do these basic exercises for your clinic website. You are done with it. Okay, and update your websites once a year whenever a different trend emerges. Otherwise, you are good to go. Now come to yourself, your branding. The rule for you is riches are in the niches. Don't try to become everything for everybody. Don't try to solve all the problems. Don't try to show that you are capable of doing everything. Identify one niche and try to associate yourself with that niche and the kind of problems you solve in that niche. Okay, so if you are a practitioner, how you are solving clinical problems in that one niche? Post cases. Okay, post your clinical cases. That is the best way to build your personal brand. So instead of posting 10 random social media posts about your clinic, okay, which give you zero engagement, start posting your clinical cases. There are so many groups. Make a name for yourself. Social media platforms have revolutionized the global connect. Make use of them. And look at the search volumes. You can go to Google Trends. You can go to any other. There are so many tools, SEMrush. You can go to those tools and you can check how many people are searching for aesthetic dentistry, implantology. Every day, the number of people in the community is increasing who are ready to pay for expensive aesthetic dentistry, expensive implantology, full mouth aesthetic rehabilitation, full mouth implant rehabilitation. More and more people are paying. Are you connecting with those people? That is the question. Make use of simple strategies, connect with those people, build trust with them. Those people will come to you. So this is where personal branding. This doctor is good. He is doing these kind of cases. If they come to know that kind of information, then your fan following, patient footfall in your clinic, reference, recommendation, everything will increase. So practitioners can identify niche areas, very, very micro areas. It can be re-root canal treatment, not just endodontics. All those failed endodontics cases I treat. I am a specialist in re-root canal treatment. Let your social media accounts talk about it. So you can say that your root canal treatment is failed. There is no problem. These are the things by which it is solved nowadays. Talk good about your field. See, category and brand, both of them are connected with each other. Your category is dentistry. Your brand is you, your clinic. Both of them are connected with each other. They either go together or they come down together. So the best way to elevate your brand is talk good about the category. Take dentistry higher, your brand also automatically goes higher. So that is one warning to all those people who talk ill about other practitioners. So the moment you talk ill about other practitioners, you are taking the category down. You are taking dentistry down. So automatically your brand also goes down. So never imagine that by talking ill about others, your brand is going up. No, you are actually taking your brand down. So this is for practitioners. For academics, you can talk about oral. You are an oral pathologist. Build a brand for yourself in oral cancer. So many startups are coming. Be a part of those startups. Write to a founder, oral cancer startup founder. You can write him that I am already attached to a college. Okay, I'm already attached to a college. My timings are 9 to 6. Okay, but in the evening I can give you 1 hour. Whatever you are doing, let me know, because even I am a problem solver in oral cancer. Look at my social media accounts. There is an opportunity there'll be an opportunity for you to become a part of that startup. Say that you are trying to educate people on fresh breath. Fresh breath itself is a big market. It's a social stigma. It's a social thing. There are so many niche areas where you can develop a personal brand for yourself. Once there are followers, then you can expand it slightly. No, don't become everything for everybody. You will not become anything for anybody. Okay, so stay in the niche, but you can slightly expand. You can add a few more relevant problems to the same core problem that you are solving. Or implantology is a wide thing. There you can choose implant prosthetics, okay, or implant in the anterior region, whatever it is. Be consistent, hit hard in that one area, and build a brand for yourself. Student, any topic you love, it can be a dental material, composite, or ceramics. And as I told you, it may not be. If you are new to this, start writing about this. Start writing about this, about movies, food, cricket, whatever it is. But be consistent in one. The day you get convinced that, yes, I had only 100 followers, but because I've been writing on this for so many days, now I've got 1,000 followers. Okay, that is your niche follow. So you will realize the importance of sticking to a niche and generating value, creating value in that one niche. Researchers, you can talk about dysbiosis, you can write about immunology. There are no boring topics. You can take my word, there are no boring topics. There are only bored people who are bored of their own life. You can create value from any topic. If it generates value, people will like it. Look at some of my posts. I am writing a long post. There is no video here. There is no picture here. See this long post. I've written about SARS-CoV-2 virus. Such a long post. Look at the number of likes, comments, shares. As long as you generate value for people, they will like, your engagement will be very, very high. Such posts can generate, a random virology post can generate more engagement than an implantology post, provided you solve some problem. So it is never about the topic. It is never about the topic that you talk about, but the kind of value you generate about the topic. So again, the same rule. There are no boring topics. If you are good at one topic, but you are feeling that inferiority complex, no, if the whole world is talking about implantology, I am talking about virology, who will listen to me? You are wrong. People want value. Start generating value in a topic that you are good at. This is another thing, another post of mine. Omicron infects throat more, lungs less. So one simple solution I gave, Omicron was affecting the throat. So instead of going for RT-PCR, you can directly start with chlorhexidine rinse on the same day. So here I quoted another tweet of mine of 2021, old evidence. There is an evidence that says if you use chlorhexidine mouthwash twice a day, it eliminates, not just reduces the count, it eliminates the virus from the throat and the mouth. Okay, so we had this solid clinical trial, not just lab trial, but a clinical trial. So I quoted very strong evidence, Journal of Medical Virology 2021, and I posted this. I created a big thread. So Twitter loves threads. One more tip I'm giving you, Twitter loves threads. So create threads. So I created this, and I post my tweets on Instagram. See, my Instagram is very, very boring. I don't put pics of mine. Okay, there is no colorful. There are no colorful posts there. It is simple text, and I posted the same thing on my Instagram. And look at the kind of engagement it generated. 4,354 dentists shared it, and 656 dentists saved it. And who are these people? Are my followers? No. My post reached almost 10,000 accounts, out of which, out of 10,000, only 1,500 are my followers, and 8,500 people are non-followers. Why this happened? Because it solved a problem. It solved a real world problem. It offered a simple solution. Okay, so this is how you should make use of social media. And look at my ResearchGate. Okay, I'm not a microbiologist, I'm not an immunologist, I'm not a pharmacologist, I'm not a virologist, but whatever I read, I put on social media, on ResearchGate. ResearchGate is a preprint portal. Okay, so I never waited, because COVID science was so dynamic, emerging so quickly. I never waited for my article to be accepted by a journal. So I started posting everything on ResearchGate only, and look at the number of reads. Reaching 90,000 in another week or so, I'll be getting 90,000 reads, and total research interest is 250 plus. Okay, and most of this, out of this 89,202, more than 85,000 reads have come only for my immunology, virology, and SARS-CoV-2 research. So there is an audience always waiting for some value solution. Somebody is waiting for you to understand their problem and offer solutions in a very simplified way. Start doing it. Writing has got great capacity. So if you want to create your brand, write with your own hand. Okay, start connecting with your audience. Next question. But I'm not brilliant in anything. You don't have to be brilliant. The game is consistency. You need to be consistent. The only thing I've done in the last 2 years is I have written every day. Some days one post, or some days two posts, some days three posts, but I have written. Okay, and I have written on complex topics. All those topics that I struggle with, I have deconstructed them and made it simplified for my audience. This is how I've been trying to generate value. Okay, I may have failed. I'm sure I have failed, but I'm trying to understand different problems in different ways. I'm trying to offer solutions. Okay, I may be better than what I'm today, but the effort is always on. I will never become a master. I will never become a pro. That is never my intention. My intention is always to remain a student. So my advice to all of you is remain a student, but be consistent in generating value. So the core message of today's lecture is build your personal brand. This is my website. My website gives you one simple theme. Get ready for the future. The picture also tells the same thing. The words also tell the same thing. Orange, because orange talks about vibrance, young, and kind of aggressive progress. So I have combined all these elements, and I welcome you all to follow me on my social media accounts. Give me an opportunity to learn from you, from your needs, and within my limitations, I will be able to offer some solutions. Thank you so much. Thank you, Department of Periodontics, Nair Hospital Dental College, Mala Madam, Rutali Kamath, for that excellent coordination. And I hope I made little justice to the topic that I was given to me within my capacity. Thank you once again.
Thank you, Dr. Rajiv. That is fantastic, an eye opener into brand and branding, which most of us really don't know. We are all from the old school of thoughts, so we always believed that the word spread of mouth that only brings us the dentist, his own customers or clients, whatever you say. But then today, with the dentistry taking leaps and bounds, and even technology going high, and even all these media which is coming to, like an old dentist always thinks, ki, what will how will the other people receive me if I start doing these sort of things? I mean, what is the need for such type of advertisements? But with the number of students coming, churning out so many, dentists day in and day out, I think these sorts of things really help to show what you know. Many people really don't know what you know. Many times you got to say that, yeah, I do know this, but people really didn't know that you also knew this. Like in old ones, they always think कि सबसे बड़ा रोग ये है कि क्या कहेंगे लोग, how will I do something which I have never done in my life before, and then other people sit down and say that मेरी किस्मत ही खराब है. It is not so. Everybody क्या वो क्या बोलते हैं ना कि आपने तदबीर से अपनी तकदीर को बदल दो. You have to do that by using these sort of advertisements really help, and no man is perfect for that matter. We all can learn, and the day we say I know everything, we never learn. So taking all these cues from I did really appreciate you for putting all this on, the way in how you can make success. Everybody likes success, and going a step ahead than what they are. They'll definitely stand to benefit by whatever things that you have said. And I hope they take advantage of these two lectures that we have today, and do their justice to whatever time that they have spent with us today. That was a really nice topic given by you. We don't have any, I think you have covered almost everything. We don't have any great questions, but then personally, I would like to ask you, how frequent are we supposed to go and advertise ourselves?
Advertising is not required only, madam. As I told in the lecture, no advertisement required at all.
So,
As
how
a
frequently I
clinician,
go to say it is good? 1 year you said you should go and change your whole website. You change the look how it is.
that is only the layout based on the current trends. So the designs are becoming more and more minimalistic. The layouts are getting more and more flat. Okay. So now people want websites to load faster.
Okay.
Okay. So if your website loads, there's a delayed loading. Slower more than it. If it takes more than 3 seconds, they may lose interest. So those technological advances, that is your technology, your IT person will be doing. That's a different ballgame altogether. So your ecosystem of website, search engine optimization, and your social media, that will remain as it is. Okay. But when it comes to your personal branding, you have to be consistent in your niche, for the purpose you build for yourself, the kind of problems you solve. So they are totally different things. So I'm not advocating paid advertising at all.
Okay.
I don't advertise. I don't for dentists who have their clinics, no paid advertising required.
Yeah, I know today everybody goes to the media. Even if they have to go and eat somewhere, they go to some blog to check which is best.
Yes.
Like people have
Yes.
got so, they look into the media onto the mobile more than each other's face. It is that much prevalent with
Yes.
all of us.
So if you are always talking on Twitter, so I will suggest make use of Twitter, LinkedIn, much more than Facebook and Instagram. Twitter and LinkedIn will connect you with your future, with your tomorrow, whereas Facebook and Instagram connect with your past. So one
Right.
is with for your future. So Twitter is like a university. Be there, always talk about science. People will search you. This person is so good, he must be having a clinic. They will search for your clinic and they'll come to you.
True. Very true.
Whereas if you continuously talk about your clinic, they will not follow you at all. They will unfollow you. So the actual exercise is so simple. Don't have to struggle with your clinic advertising. Just talk about one problem. Just type, don't even design anything. Simple text, and your branding will be done.
Thank you very much, Dr. Rajiv. And here we just place a token of love and appreciation for this talk that you have presented today. And the one, this is virtual. The actual will be reaching you in some time. And with this, yeah, I, I ask Dr. Pranita Kamble to please take over for the vote of to propose the vote of thanks.
Thank you, ma'am. Good morning, everyone. So, after the enlightening session of the first online webinar organized by the Department of Periodontics, Nair Hospital Dental College, I would like to extend warm thanks to our speakers of the day, Dr. Ashutosh Karnik and Dr. Rajiv Chitkupi, for sharing their pragmatic thoughts and experience on the diverse topics which are the in thing right now in today's dental practice. A big thank you to our beloved Dean, Dr. Nilam Andrade, for sharing their online platform. And a big thank you to our
Pranita,
beloved
you're
Dean,
mute.
Dr. Nilam Andrade, for sharing their online platform.
She's muted herself.
Sorry.
Okay. Yeah.
Big thank you to our beloved dynamic Dean, Dr. Neelam Andrade, for her constant support and guidance. Thank you to our sponsors, ICPA, for sharing their online platform, and to Dr. Rajiv Chitkupi and Ms. Shrishti for coordinating and for all the technical support in the success of this online program. Thank you to all the staff members and postgraduate students of the department. A special thank you to Dr. Mansi for preparing the video and the teaser. And no program is complete and successful without the participation of the enthusiastic audience. So thank you to each and every participant for their active participation. With this, we come to the end of this session. Thank you, everyone.